for the health department. Can you advance the slide? There we go. So I'm gonna cover a few things today. These are some of the highlights from the last quarter. So we did our first health and resource fair. We are instituting a sensory-friendly clinic initiative going on right now. I'm sure everybody is interested in cyclospora outbreak and response, especially here in our own county. And then just looking ahead. Okay, so the first thing, some of the highlights from the Health and Resource Fair, which was done in conjunction with our human resources here. The initiative basically was to ensure that we were promoting health and wellness and well-being in our county. We wanted to make sure that the consumers and clients knew where they could go and many of the services that are here and available within our county to help them. We wanted to promote health education and preventative health measures and provide information. We wanted to make sure that we connected individuals within our county as well as our employees with services, foster collaborations among the community and our community partners. So just some statistics, We had over 235 attendants, 235 that we can confirm, but we know that many individuals brought people with them and they didn't turn in things. We did not quite have a good response on our survey, so we will work to make sure that that's better in the future. We had over 52 different programs that participated in the survey, which included employee wellness. We also launched the Compass, our new mobile health unit, provided a lot of health education. We had 3 food vendors present. We did some resource navigation. We actually had a few stories where people came in and said how it really helped them. We had one client that came in that had a child that had special needs. They were able to get services for those special needs. They apparently were able to apply for a job through human resources at the time, and then they were able to bring their older child in to get hearing and vision services, and they were all here for a completely different purpose. So that was just one example. We also provided over 20 gift cards for either food or gas, and we know how expensive those things are. So those went to anyone that entered into the raffles, and we had 2 different games and raffles. So the health fair definitely was part of the mission and vision, and it definitely, it definitely promoted the board's newly voted on priorities. So, okay, next slide. Okay, so the tools that you have here is a part of a new initiative that was brought to us by our staff. We allowed our staff to enter into what we had was 3 different $5,000 mini grants, which came from a larger grant that we had, and the staff were asked to present ideas to us, things that would move the health department and the county forward, and initiatives that we could keep going. One of the winners, and it was something that was voted on based on priorities. One of the winners was a sensory-friendly environment in our clinics. So we're starting off with 2 areas where we see the greatest need. That would be in our immunizations clinic and our WIC clinic, where we have a lot of children and adults come through. So some of the things or the goals of this is it positions Genesee County, the health department, as a proactive rather than reactive, using internal funding to pilot this. So this was through our public health infrastructure grant that we get from the Michigan Department of Health and Human Services. Staff with lived experience. So we have a number of staff that experience some of the neurodivergent um, illnesses, or their children or family and friends. So I think all of us probably know someone or have someone close to us that needs that experiences this. So autism is a big thing here. So it brought valuable insight into the health department of things that we were needed. So it helps meet some of the unmet needs in the community. And based on the national research, it shows that autistic adults, as well as children, have lower rates of health care due to avoidance or stemming, problems with touch or close environments or physical environments. The environment is overwhelming for them. We also know that no one wants to come and or kids don't want to come and get immunizations anyway, so it's already a difficult experience, so we want to try to make the experience better for them. Okay, so some of the accomplishments to date, and we're still working, we're just starting to get this up and going, but we sent our staff in the immunization clinic, as well as our WIC clinic, and we have Leah, who is our community health analyst that went to this training. So in our clinic areas, we have staff that have achieved the most valuable provider status. So basically, they had to go through a training, take a test, and get approved to receive the certification. This is something that once we figure out all the kinks and everything, that we would like to roll out through the entire health department and then bring it to you to roll out to all of our areas. So it's a pilot program right now. So it helps with awareness and education, communication, behaviors based on strategies that help, tools they can use to provide support. Our staff are well trained, and they're trained on how to deal with clients that have certain issues or concerns. We've also incorporated intake procedures so that we can ask these questions up front, so we know if we need to have it set up a certain way or what we need to have for the room, so we get the input of the parents, and we know before they come. So the implementation is ongoing, and we're working with the staff, and we're doing, once we get it all in place, we're trying to evaluate the process, so we make whatever changes that are needed. Next slide. So the last area that we're going to cover is the communicable disease update. We'll talk about cyclosporiasis because it is on the rise. This was created on Monday, and I just wanted to point out, since Monday, we've had an additional 1,000 cases increase in the state of Michigan. So instead of 6,148, we have 7,171. And in Genesee County, on Monday, we had 269 cases. Now we have 344 cases, which is an increase of 75 just since Monday. So it is continuing to grow. Fortunately, we have a very low number right now of hospitalizations, so only 1.66%. But just some interesting facts right now, most of our cases up through Monday, 31% are in Flushing, 20% in Flint, 14% in Swartz Creek, and 10% in Grand Blanc. We don't know why those particular areas are experiencing this right now, but that's just some facts that I thought you might be interested in. So, next slide. Okay, so just some of the current efforts that we have going here in Genesee County. We are doing the case interviews. We are slightly behind because they are increasing rapidly. There's a very extensive interview process we have to do when we get those. There's coordination with Michigan Department of Health and Human Services. We're also working with MDARD, Michigan Department of Agriculture and Rural Development, and they are collaborating with the federal government. We're doing laboratory coordinations with our providers, with the hospitals, and for individuals that need it. Exposure investigations, obviously public messaging, and provider alerts where needed. Okay? We're providing updated recommendations as they change. So some of the current recommendations, just so that everyone is aware, is if you think you're experiencing this, you should go to your healthcare provider. Consider any prolonged, illness or diarrheal illness, as a concern. Make sure with the healthcare providers, they should make sure they order the appropriate testing, and we have discussed those with our providers here in Genesee County. For residents, you should seek care with your doctor, visit a walk-in clinic. We don't necessarily do testing here. So some of the symptoms that you should be concerned is if you have a fever over 101 degrees Fahrenheit, increases in fluid loss through sweating, if you think you have lots of diarrhea, if you're starting to feel dehydrated. Next slide, please. And for babies or the elderly or older individuals, anyone, if you already have a high-risk condition or you fit in a high-risk category, which they are, you should see your doctor sooner. So don't let it get extremely bad. If you are experiencing dehydration, symptoms of dehydration or extreme diarrhea, if you start to feel confused, feel like you're going to faint, or little to no urine, or have a rapid heartbeat, please seek a medical professional. So some of the precautions, obviously thorough and proper hand washing when you need to, using soap and water, both before and after handling food. Wash your fruits and vegetables, even if they are in packaging, even if it says it's already washed. If you're going to eat lettuce, choose whole heads of lettuce or cabbage. Remove the outer layers, okay? Make sure you thoroughly wash it. Cooking is preferred if you can. Cut away any bruised or damaged areas of your fruits and vegetables before preparing or eating them. And then make sure you thoroughly wash, rinse, and sanitize your utensils, any cutting surfaces. That would include like in your refrigeration where things were stored, display cases, containers where you had fresh produce. So upcoming thing, looking ahead, we're going to continue the surveillance. Obviously, the federal government is looking and investigating to see the common source. I know everyone seen the information with Taylor Farms, that they have done a voluntary recall, and we are working with the state, and the state's working with the federal government to see where all those products have gone so we can work on ensuring those things are not still in any food service facilities. Also, you want to look at what's in your own in your own refrigerator, or anything that you may have purchased, if you have receipts or things like that, to see if you have that in your home or if you have it. So other things, we're going to continue to expand our sensory-friendly services, prepare for our upcoming respiratory season, like flu and basically our flu season, and then continue our community outreach, and then we have our fall immunization planning as well. So I believe that's it. Do you have any questions?
All right, if I might, before I recognize Commissioner Lloyd, I wonder if you might introduce by name your staff.
Okay.
You have at least two people here.
Yes.
Would you do that for us?
So we have, come on up, we have Joanne Herman, who is our outreach. She's like our main immunizations outreach person, and she deals with a lot of outreach on a lot of our new initiatives. So she basically travels across the state and is a huge resource for us. And then we have Leah Johnson, who was newly promoted to our community health analyst. Before, she was our admin health educator, but she's our community health analyst now, and it was actually their idea chosen. So all the sensory friendly stuff is their baby. So
Thank you for being here and for your commitment to the health of our community. I know both of you, so I know you deeply believe in the mission of what you're doing. So thank you.
Yep.
Commissioner Lloyd.
Thank you, Mr. Chair. Thank you so much for the presentation, the information provided, and to your team for the awesome work that you do. Question as it relates to this illness that is growing a bit. The information you share with us, great information. How is that information being shared with the public beyond maybe our website and those kinds of things? Have you all done any press releases, press conferences? How are you getting the information out to the general public?
So we talked to the media a few times. We've done a press release on it. We've updated in our websites regularly, and they provide information as a part of outreach as well in the community.
Maybe this is a question, Mr. Freeman may can answer this. If our the individual who's acting or serving as a part of our emergency management team, because the emergency manager is someone other than those who identify as it according to the law. I won't put anybody on the spot. But do we have some type of notification system in the county where information go out to the general public when we have, I know we have the alert systems like if, somebody's kidnapped and those kinds of things, but what about for health emergencies or other crises?
So I think you're talking like a reverse 911, where that goes back to people. I'm not sure what capabilities we have on just the county side, independent of 911, but they do also have an emergency manager within the
We have
health
an EPC.
department.
Mhm.
So we can look into that and find out for you what those capabilities are.
Mr. Lloyd, if I
They
may.
sends out MyHans to us, but sometimes the information we're allowed to share right away, and some we are not because they're still confirming. So they they give us an idea of where things are and what they're looking into. And if they need us to, for example, go to a restaurant and grab something, or with the state, they would go to possibly a grocery store or a warehouse. And sometimes they may ask, because we have agreements with the state, if they're overwhelmed and they don't have enough inspectors, we'll say, for the facilities that they inspect, they may ask us to go in and sometimes seize products, which we're not there yet, but we are talking to our food service facilities and investigating to make sure that they're double checking and make sure they don't have these products in there.
Sure.
Mr. Lloyd, I thought of something and asked Mr. Freeman to speak to it based on your question, if you would.
Yeah, we also have the IndiGov system where we have contact information, not for the entire county, but for a large majority of the county. And I'll have Jared get with the health department tomorrow, and we can put something out that way as well.
Thank you so much. Appreciate the information. Certainly assured and confident you all are doing a great job. Just a larger question or comment for my colleagues and our Director of Administration is that I'd like to have a more robust understanding of what emergency coordination looks like across Genesee County. It's not something that I got all the way into during my time serving this body, but I think it's something we should maybe be more abreast of. Emergency managers and what departments, who's reporting to who, what kind of flow chart, what kind of protocols are in place to respond to certain, varying crises. And so I digress with that. Thank you.
Mr. Chair, that's actually really timely. We're working on our continuity plan right now. We've got a draft. We've got a work group that's kind of looking at that. So once we get that draft updated, we'll do a presentation to the board, and it'll walk through what you're looking for.
Thank you. And a board workshop on that as well, where folks come in and talk about it.
That's a
my
great idea.
suggestion for a workshop.
That's a great idea.
Thank you.
Do we have additional comments or questions for Director Estelle? I have a couple.
Okay.
So if I'm remembering right, at the budget hearing on July 1st, when you were presenting along with Dr. Brad, the Compass piece you mentioned, that's our new mobile unit. And it seemed to me that the plan is to sort of scale it up gently in terms of its exposure and its travel around the community. Talk a little bit more about what the plan is there, and if we as commissioners know of places within our districts or elsewhere in the county that might benefit from it eventually, a visit, how would we go about connecting the community with you all on that?
Okay, so I'm gonna bring Leah up with me
Okay.
because she's our
Very good.
she's our guru with setting this
Okay.
up, and she's the one helping.
This is
setting-
why I bring
ma-
backup with me wherever I go.
So,
Oh,
Leah?
yeah, absolutely.
so we are setting up a system.
Yeah, so we're getting ready. It feels slow right now because there's not a lot of spaces that are already prepared to take us. So we had talked to the folks.
Would
that
you
were set
back up and just describe what the unit is first? And
Do you want to do that?
So,
that
it's
might
a
be helpful.
38-foot mobile health unit that is, it is designed so we can do all of our services in the unit, although we are still working on getting some approved. When you have federal grants, the rules are more extensive, but we can provide services in the unit. It's designed to go to any area of the county as long as, it can accommodate the size, and it's allowed where it's being requested. We have received some requests. We've had few people follow the process, so we have to ask a lot of questions. The only place we've used it so far is at the HIV day, HIV testing day. But we do have requests that are coming in, but it's still in the process. So we have to make sure people fill out the information so we can actually say, yes, we can actually bring the unit. So we don't want to go someplace and then get a ticket because we're not supposed to have the unit there, or we need approval from the city, village, or township, which I know from being an inspector that you can't just drive a mobile unit up and do it. But go ahead.
Yeah.
You can talk about the setup.
So I'm working right now on putting together a presentation for our community partners, which we can give to you guys as well, which breaks down the survey. So what we need to have on site, what size space we need to have us, because we have to cone off the back corner of it as well because of the heat, because that's where the exhaust and the generator is. So it'll include service requests. So the mobile unit has lots of space, but we can only really provide one primary service on the mobile unit at a time. So the request form will auto-generate a calendar invite for us to review. So partner will request for the event, the time, the space, location, and then we'll have to confirm with them that we have to be there an hour early to make sure that we can set up and get running okay, and then who the primary contact is. Because sometimes in parking lots they can have low telephone lines, we have to even make sure that the telephone lines are high enough getting in the parking lot for the mobile unit to enter it. And then we'll be using social vulnerability index data to track it on the back end to make sure that it is getting used effectively, and we're making it to the high vulnerability index zip codes, which we have 11 of in the county. So we're going to do hopefully a big push out when we're ready to do our partner presentation, and we'll make sure you guys are included in that.
Okay. Leah, are you the point of contact if people in the community want more information about how to schedule this, or if commissioners need to send people?
That would probably be Brad for now.
Okay.
I'm just playing the support role, so I'm building
Okay.
all of the tech on the
I see.
inside, and then Brad is still going to play
You're the
primary
infrastructure.
contact. Yeah.
Brad
I'm
is
just
the
playing support.
guy. Okay.
And we just offered the position to a driver. So that was a big key as well. So we're excited about that.
Okay. My last thing is a compliment to you, Director, on all that you've been doing, and you've gotten some accolades from outside organizations your department has, so congratulations again.
Thank
I want to personally thank you and Lynn Radzalowski from Senior Services for visiting the seniors in Swartz Creek at the luncheon that I host out there quarterly that I was myself not able to attend. And I hear that you were both a big hit in terms of what you shared, so thank you for that.
Great. And we will actually be reaching out to you guys to help us connect with the city, villages, and township to make sure that they know it's here, and to help explain how to apply, to register and request it and things like that. So we want to make sure we get the information out and that we're serving all of our residents to the best of our ability. So
Very
thank you
good.
all.
Thank you. I think we're all set. Thank you.
Thank you.
Mr. Freeman?
Mr. Chair, Public Works Chair Brian Flewelling requested this presentation, so I would turn it over to you.
Okay. Yeah,
Commissioner
so
Flewelling.
Plant Man Real Point, they met with, I believe, Commissioner Kuzno and Getzinger a year ago. They do some things that may be able to assist us with our capital projects. I don't know. So I thought, let them present to the board and you guys can make your own mind.
Okay. All right, welcome, gentlemen. If you would introduce yourselves and then proceed.
Thank you. Good evening, Mr. Chair, and good evening to the rest of the members of the board. My name is Andy Fountain. I'm a newly minted partner with Plant Moran Real Point. I'm in day 22 of my partnership with the firm.
Congratulations.
Thank you very much. Been with the firm in total for just over a decade. Prior to Plant Moran, I've worked in construction management. I worked for a public school district, and then spent, as I said, the last 10 years here at Plant Moran Real Point. I have a couple other team members. I'll let them introduce themselves, and then we'll kind of get into a little presentation that we have. Thank you.
Good evening, Todd Fenton. I'm relatively new to Plant Moran Real Point. I've been with the firm a little over 2 years, but I actually worked pretty significantly with the firm when I was the Economic Development Director, then Deputy City Manager and City Manager of the City of Royal Oak, where we were looking at transforming a sizable piece of downtown into a public-private partnership in terms of activating new city facilities and encouraging economic development through the use of new office space downtown. And so when I wrapped up that 5-year assignment working with Plant, I thought, there are a lot of cities, there are a lot of counties, I know this being a public sector person, that are looking for this sort of strategic real estate analysis. And what better way to be able to continue to fulfill my public sector passion on the private side by continuing to work with municipalities and counties in terms of recalibrating what some of their real estate assets are and looking for opportunities to even bring or spur in more economic development. So really happy to be here tonight. We're going to keep the presentation brief. We know you've got a very healthy agenda tonight and a lot of county business to work through. And again, we just appreciate the opportunity to be here. Thank you.
Good evening, Commissioners. Joe Asperger, Senior Vice President with Plant Moran Real Point. Some of you may recognize me, lifelong Genesee County resident. Been with Plant Moran Real Point about 3 years, but spent nearly 20 years working for Kettering University, involved with a lot of our capital development and our revitalization of Flint through the Flint River District. So resident of Grand Blanc, and as I mentioned, been with Real Point about 3 years. Thankful to be part of here in Genesee County, but working with the firm, being able to provide my experience as an owner, background as an architect, and being able to understand, what revitalization and everything looks like, especially here in Flint, and to be able to bring that to the team. So thank you for the time. Certainly hope that this is influential to be able to share, what we can do to be able to sit on the owner side of the table, to advise you through your real estate capital development type endeavors that you've got before you. So thank you.
Thank you, Joe. As Todd and Joe mentioned, we understand you have a rather healthy agenda. We'll be timely here, hopefully very informative at the same time. As my mentor would say, make sure you're seen, you're heard, and then you're seated. So we'll follow that protocol. If we could move to the next slide. I would anticipate that many of you may be familiar with Plant Moran. I know we perform audit and assurance work for you, as well as our group benefits group has worked with the county. And so in similar fashion as the group benefits, we are a affiliated entity with Plant Moran. Plant Moran's obviously been around for a time, over 100 years. If we could maybe click to the next slide, please, that'd be great. Who is Real Point, and who are we? What do we do? To state it simply, we help people build things. We help people think. We help people be strategic with their real estate and capital development opportunities. And what we do is we serve in the capacity as a fiduciary to our clients, acting in their best interest, advising them as they think and make decisions related to real estate assets and other capital development opportunities. We've been in existence since 1995. We were born out of the concept that Plant Moran has plenty of clients that have lots of real estate needs, and instead of referring those needs to other entities, they figured, why not just refer them to themselves? So we were born out of that concept, and we're on now our 31st year in existence. Just a couple of quick stats about how we kind of fit into the firm as a whole. Plant Moran as a whole, 4,000 staff members. Like I said, we've been in business for over 100 years. Real Point, we're involved in roughly $7 to $8 billion worth of capital development here in Michigan and really beyond in the region, into Ohio and some other areas. And we like to think of ourselves as kind of the go-to real estate consulting firm, certainly within this region and across the state of Michigan. And we are, as a way of example, you heard Todd talk about his public sector experience. What he also didn't tell you is that he worked for another county, sister county of Genesee, in their economic development department for over 20 years. Joe mentioned that he's got an experience working for Kettering. He's got a background in architecture. I myself, I'm a construction professional. We have over 150 staff members. I think the latest count, I think we're up to 153 as of this week. We hired somebody else to join the team. We come from a diverse background of experience. We have attorneys, we have accountants, we have construction professionals, we have economic development folks. We were very, very intentional about the folks that we add to our team. And the reason we do that is because through that diversity of experience, we're able to better inform our clients when they're facing real estate opportunities or challenges. And so I say all that to you that, beyond the three of us here today, we have a rather deep bench that we feel very confident that we're able to offer solutions and strategies to our clients when they're facing capital needs or potential opportunities to partner with either private developers in considerations of public-private partnerships and other opportunities related to real estate. If we can go to the next slide, please. As I mentioned, we're a team of 150. We've got a very diverse experience across the entire organization. If we can go to the next slide, please. I mentioned we introduced our team. One team member had a conflict tonight, so she wasn't able to join us. That's Nicole Blocker. She's another partner with Plant Moran Real Point, and her and I kind of are in the public sector on both education and municipal entities to advise on their needs. If we can go to the next slide, please. We can go into the services. So when we talk about our clients, they're typically faced with a myriad of different challenges, opportunities. Some of the things we hear is, should we lease? Should we buy? Should we dispose? Should we reposition? Is there what's the financial pro forma going to tell us about what an opportunity looks like? Where are the risks in this opportunity, or maybe where are the what are the upsides in getting involved in a program? Should we relocate? Should we stay? These are all things that are kind of inbound, and that we help our clients to distill that information and come up with a cohesive strategy that's unique to each client. So the solution that may work for Genesee County may not be applicable to perhaps a Macomb County or a Kent County. Every client's a snowflake, and so we like to think that you're all unique and you all have very, very specific nuance to your solutions and to your opportunities. And we like to champion ourselves as not only leading you to a solution, but really taking the time to understand what the need is, what the opportunity looks like, so then we can better inform you of opportunities and solutions. Next slide, please. I'm not going to go through the whole presentation. This thing is 25 pages. I just want to concentrate on this one thing, this next slide here. It really breaks down what are the key service that we offer. It really breaks down into three different categories. We have a consulting group, and I'd like to think that group is the group that helps to receive your inbound or distill your opportunity and help to better understand what the ask of the question at hand is related to your specific need. So what does that look like? We do market analysis. We advise many clients on incentive opportunities as a municipal operation. That's not necessarily on the table, but sometimes it is, because you have public-private partnerships that are plentiful these days, and incentives are a key component in making those programs a go. We can do facility condition assessments, we can do space needs utilization, anything and everything that you need to do to get smart about what your opportunity is, and then start to develop options for considerations as you funnel towards a solution. We also have a transaction group, pretty simple. If you need to buy, you need to sell, you need to lease, they can help you be smart about what that opportunity is and then facilitate whatever transaction is necessary. And then we also have our owner's rep and development advisory group. Essentially, this team is, once you've made all your decisions and you've acquired or disposed of your assets, and you're ready to implement the program, we can serve on your behalf and assist you through the process of a capital program, whether that's an infrastructure, horizontal solution, a vertical solution, as I mentioned, a P3 opportunity. All of those different opportunities we find ourselves in the middle of every day, whether that's right now with Huntington Place down in Detroit, and inside of a $500 million program to revitalize the convention center, Macomb County for their new jail facility, and other municipal clients. We serve in that owner's rep capacity to help make sure that there's that certainty of outcome. You made a plan. You want to make sure that the program and the opportunity is executed in accordance with that plan. There's lots of other information in here that I won't bore you with. There's examples of other projects that we've been a part of here locally in Genesee County and beyond. And I'd be happy to field any questions that you might have, but we'd look forward to having further conversations if it's appropriate with you.
Thank you. Commissioners? Anything at the moment? Commissioner Lloyd?
A couple questions.
Yes, sir.
Thanks a lot for you all being here. Thanks a lot, Commissioner, for having the team come. I think that we have an awesome team here at Genesee County that's done some great things in terms of building projects. I'm sorry. Thank you. Thank you. Done some amazing things in terms of building projects, and as some of my colleagues know, for probably about 4 or 5 years or so, I managed a property holdings corporation for the International United Auto Workers Union, and so I had a responsibility for every property that we had across the United States, as well as Puerto Rico and Mexico as well. And so buildings that we purchased, renovated, properties we leased out. I was responsible for leasing properties. All of the maintenance, whether it's a parking lot or putting a new roof on or windows or tearing it down, rebuilding it, I had a responsibility for, along with just a very, very small team. So we work with companies like yours, general contractors, a number of the major contractors across the country. High-rise buildings. I mean, we just did a project much like this building, which our team did a great job, where you're talking, a couple 100,000 square foot, multi-tower project where we spent on Jefferson, downtown Detroit, where we spent over $90 million. We gutted it down to the studs as we did this building and really rebuilt the entire project after a major fire. I'm saying that to say, not to run down the resume, but to suggest that even with all of the experience that we have had, I would not suggest that I am a professional contractor. I would not suggest that I am the most experienced, even with that. I mean, you're talking hundreds of millions of dollars in terms of our properties portfolio that I was responsible for 5 years. That would suggest that, hey, I have some experience, but there's so much that I don't know and so many that we needed to hire, even with our large team, to help guide us through, varying projects. And so one of the things that's concerning, to me is that we have a lot of projects that we need to do across the county. And we have an amazing team that's thinking through it. There's a couple that are in the room, Derek back there, or Ray, or Derek helps him out too, Ray and Josh. But, I think it's something worth considering, having, others to help support that. Now, whether it's you or whether it's someone else, there's actually, definitely a process for that. But one question I just had is that, when you're talking to, cities, townships, counties, at what point in the project do you think it makes most sense, or do you recommend a county bringing in a company like yours to support? Because it seems like you offer a lot of services.
Right.
But at what point, given we have a staff and we have folks,
Right.
at what point do you suggest?
Yeah, I would, a great question. I think that from our perspective, the sooner we're involved, the better we can provide that level of certainty in the outcome. I think that we work with all sorts of different clients. They have all sorts of different needs, and many a time they've already done due diligence, they've already prepared a plan, and then they get to a point where they need additional, resources, they need additional help, and we step in the middle. We're flexible enough in our approach and the services that we provide where we can really be inserted at any point during the project or during an opportunity. The position in which we can have the greatest impact and create the greatest opportunity for the return on the investment of our services is at the beginning. And I say that only because we understand we work with lots of, as I said, lots of different groups. There are lots of great folks that work in municipalities, but as Commissioner Lloyd stated, even with 5 years of that responsibility, we have 150 folks that, they have a diverse experience, and there are other opportunities that you may not be aware of. And we like to think that we're in a position where we can at least apprise you of there's an opportunity on the table, you can consider it, and if it's a non-starter, if it doesn't work for you, then no problem. But we think that by being involved sooner than later, you know what those opportunities are before you've crossed certain thresholds in the process where you've forfeited an opportunity. And so we like to be involved from the beginning, but that doesn't mean that we can't be inserted at any point in the process.
So one of the things is when we talk about some of the things we talked about from capital improvement standpoint, we talked about our recycling center. We talked about the courts, which I won't even get into, right? And we talk about some of the other things that we need to do. One of the challenges that we're working through and figuring out is what funding looks like.
Mm-hmm.
I mean, like even with, a company like yours or somebody else, before we even get to some of these projects, we have to figure out how we're going to fund it. So one of the things that would be interesting to me is finding somebody who can help us figure out how to fund
Right.
the project or other funding sources, because we can't just keep going to our residents. And so do you all offer that kind of support? What
Right.
does that look like? What are maybe alternative funding
Mhm.
that you've seen other municipalities do or that you recommend? Like what kind of support will you be able to provide there? Because
Sure.
if we don't secure funding, there's no projects.
We always, one of our other famous lines, always start with the money, because the needs are never short. They're always more than what what folks can afford. Even personally, I have lots of things I'd like to do. But to your question regarding funding, I mean, there's obviously the traditional method. You can bond. You have general fund. You have cash. But there are other tranches. There are grants, which that's not like a foreign concept. I think everybody's familiar with, federal programs and what have you. But when it comes to exploring alternate sources of funding, when I mentioned our involvement in public-private partnerships, we've found ourselves in the middle of more of those conversations in the last, I'll say, 2 to 5 years, where municipalities have a greater willingness because of what you articulated of, I don't want to always go to my residents and ask for a millage. I don't want to increase taxes. So the private, the private development community is now, I'd say, more engaged than they ever have been in exploring opportunities with municipalities to solve for capital or real estate solutions. And so when you start talking about engaging with the private side, that actually opens up opportunities for them to not only come in and develop, but they can bring funding along with them. And we can serve in the county's capacity to vet these opportunities, apprise you if you're getting a good deal, or if there's opportunity for negotiation. So that way you can then leverage the assets, whether that's capital, whether that's real estate, in a deal-making solution that you don't necessarily have to go out and ask for additional taxes, but still providing a solution by partnering with the private development community. That's just one example. There are lots of other opportunities that are out there. It really comes down to what the scope of the program looks like, and then we can help you kind of at least steer you in the right direction. Say, there are these other options. Are they of interest to you? Do you qualify? Or perhaps there's this opportunity, but it might not be the right fit because you're going to have to induce, and then that might not be appetizing to the county. So just a couple different ways that we think about that. But yeah, certainly helping our clients find the money is something that we handle all the time.
I have one more question. So another thing that I ran into with different projects that I've been responsible for is building consensus within the organization, within membership, local unions, our constituency. So for us, it's our residents. Because we may have an understanding of why we're doing whatever we're doing, but if it's a $100 million project, $150 million project, the residents may not understand, right? And so when you're talking about different funding sources and, figuring out how you're going to do it and engaging all these different pots, there's an education piece that goes along with that too. And so when it comes to like partnering as it relates to building consensus across community with different stakeholders, like for us, like judges and that kind of thing, how do you all support that kind of work? Because I've used the company to assist with that as well.
Yeah, certainly the consensus building is a major component. It kind of lends to getting us involved sooner than later, because we can then start to assist you in that communication and that engagement with the community to make sure that you all have a need, but making sure that those residents, that members of the community, whether that's individuals or businesses, that they have a forum and they have an opportunity to opine on what their position might be on your solution or what you're considering. So I'll just take K-12 for example. We have lots of different. I think we have over 50 different K-12 bond programs that are in process in some way, shape, or form within the state. I'd say it's anywhere from 70 to 80% of those. As part of our services, they'll hire us to then provide that consensus building, that community engagement while they're planning their bond program or building their solution, and then also helping to assist to provide information as they educate the community when they pivot from, we have a plan, we've got your consensus, into now making an ask, whether that's for a millage increase, an extension of an existing millage, what have you. So that way the community is part of the solution building, and then also part of educating them about, well, here's where we landed, and here's why, and here's what we're asking for your support. That process is something that we find ourselves in the middle of on the vast majority of our engagements. We know that in the public sector, you're a consensus decision-making entity. And so many a times we find, in a postmortem exercise of why did this not work, that a lot of times we'll find that, oh yeah, there was a miss here, and because the community wasn't properly engaged or wasn't afforded the opportunity to opine, that's a lot of times where they say, oh, we need to back it up and start over, or we need to have a different approach next time.
We need to, in conclusion, I appreciate that, because we have so many different and I know I'm banging my head, I don't even really want to talk about properties, seriously, because we don't know how we're gonna fund it, we have so many different projects we need to do, but we have a lot that we need to do in a short period of time. And, for me, you know, whether it's, you know, us having general contractors, which we've used, right? Whether, it's having, you know, we've had different insurance brokers to assist in different projects. We've hired different professionals to help in different areas. Even with our expertise, even with our thought processes, there's things that they knew that I did not know. Like even when I talked about consensus building, for instance, I'm within the organization, president, VPs, all of the stakeholders, but I didn't take for granted that my relationships will be able to get it done, because folks that are looking for the answers, they may receive certain things from those that do it more than, you know, whatever my experience is. So I think it makes sense. Would you all be willing to come back? Because, and the reason why I ask that, because there are a couple key members of our board, particularly our economic development chair, who's not here, and she probably have more questions than me, and great questions, but I don't know if you all would be willing to come back at some point or what have you, but I appreciate, you know, what's been shared in the time. Thank you.
So we welcome the opportunity to continue the conversation.
Do we have additional comments or questions for our guests? Thank you, gentlemen. We appreciate you being here.
Thank you. Have a nice evening.
You too. Mr. Freeman, do you have anything else?
Just two more things. We talked when we were at NACO about a possible conference, a priority workshop, a workshop around priorities for the last Wednesday in August. So I'm just throwing that date out there right now. I'll send around an email, but it's August 26th. So I'll send around an email, see if everybody wants to call.
Yeah, and if
workshop.
I'll expand on what you said in terms of the content. So in January, we adopted our priorities. There are 4 categories, as you recall. And what I was suggesting to Mr. Freeman in New Orleans is that we should have an update in person with all the commissioners at the table, probably in the form of a workshop, where we can find out what the status updates are on each priority, and then there's sub-priorities, if you will, under the 4 headings, so that commissioners can be up to date in real time with what staff's been working on and what we've been working on in terms of the priorities as a commission, but also where we haven't moved on some things, and perhaps put a little more emphasis on those so we can get some forward traction. So that would be the topic of the workshop. We could always add something else to it, but I'm assuming that's at least an hour and a half, maybe 2 hours.
Yeah, that would probably be a full workshop, I would think, on that, because I'd want to bring in some departments too, just talk about the initiatives.
Okay, yep. So, Josh, you're going to send an email,
I'll send it out.
and if you would respond to Mr. Freeman about, in terms of your availability.
That'll go out tomorrow.
Okay, thank you.
And then one last thing, in front of you, I think I've talked to all of you before the meeting, is the updated animal care millage renewal proposal. I talked about this at the last meeting, that we were waiting for the new numbers to come in of what the revenue generation would be, or expected revenue generation would be. So that's included in this, which is just an administrative change. I don't think we need to change anything.
And you mentioned that
terms of
last week when we were in committee, and that's reflected in this document.
Yep, so this is the document that we'll
Be voting on.
forward.
All right, thank you, Mr. Freeman.
Yep, that's all I have tonight. Thank you.
Real quick, before we move on to reports of standing committees, I want to make sure that it's noted for the record that I did hear from Commissioners Brown, Cousineau, and Getzinger today that they would be absent from our meeting. So we'll let the record note that they are excused. Under reports of standing committees, Board of Commissioners, there is nothing. Under Community and Economic Development, Chair is Dr. Beverly Brown, Vice Chair is Sean Shoemaker. Mr. Shoemaker.
Yes, I would like to have a motion to move resolutions 1, 2. If I can have a motion and support. Do I have support? Support.
All right, consent agenda has been moved and supported for items 1 and 2 under Community and Economic Development. Are there any separations? Is there discussion on the motion? All those in favor, please signify by saying aye.
Aye.
Any opposed? Motion is carried. Do you have a report, Commissioner Shoemaker?
No report at this time.
All
Mr.
right,
Chair.
no report. Thank you. Under the Finance Committee, it is chaired by Commissioner Cousineau and vice chaired by Commissioner Getzinger. In their absence, I will move as a consent agenda items 1 through 14.
Support.
Moved and supported. Are there separations? I'll ask you for that. So it's on the floor. Are there separations? I'll give you a minute. No separations? All right, is there discussion on the motion? All those in favor, please signify by saying aye.
Aye.
Any opposed? The motion is carried. I do not have a report under the Finance Committee, I will say that. Next committee is Governmental Operations. That is chaired by Commissioner Lloyd and vice chaired by Commissioner Shoemaker. Commissioner Lloyd.
All right, I'm gonna move items 1 through 11. If there's support.
Support.
Are there any separations? Oh, no, I don't do that. You do that. Okay.
Are there any separations? Mr. Shoemaker.
Thank you, Mr. Chair. Items 5 and 11, if we could have those removed, please.
5 and 11? All right, any other separations? All right, so do we have discussion on the consent agenda of items 1 through 4 and 6 through 10? Any discussion on that? All those in favor, please say aye.
Aye.
Any opposed? The motion is carried. Mr. Lloyd, do you want to move number 5?
Number 5, Resolution 2026-0704, approval of request by Genesee County Sheriff Office for the purchase of a Virage truck driving simulator in the amount of $155,612.00 to expand workforce development for the Genesee County Jail Ignite course offerings. I'm going to move it for discussion.
Is there support?
Support.
Moved and supported. It's on the floor. Do we have discussion?
I'm going to defer if there's
Commissioner Shoemaker.
Thank you. I wanted to say thank you to the Sheriff's Department for reaching out to me. I still, as someone was around when this program was initiated, was told at the time it's not going to cost us any money or things weren't going to cost us any additional dollars. I'm being told it doesn't, but I had Crystal send me some numbers, and there is some cost with everything, as there always is from there. My problem, once again, is the process. The simulator is sitting in the room. Now, they can remove it. They can take it out, and I appreciate the call from the captain explaining everything to me, but unfortunately, like I said, this is not something that I believe we need right at this point. I also believe these funds could be spent on other things. Now, we're backed up against the wall, and I appreciate the conversation that was had, that we were backed up against the wall. How did we get there? So I appreciate that opportunity to speak, Mr. Chair, and thank you very much.
Do we have additional discussion? Commissioner Lloyd.
Yes, thank you, Mr. Chair. Much appreciation to my colleague for his comments. Excuse me, as well. You know, I think that there's two pieces on one side for me is that I think that we have a duty and responsibility not just to house inmates and such, but also to do what we can to offer training and such so that when those that are being released from being incarcerated in our jail, that they're able to, you know, if possible, have some type of tool or something that helps them to engage, to be reoriented to community and be able to make a living. I do agree with my colleague as it relates to process. That's for any department, any office across the county. It's important that we secure the appropriate approvals before monies are spent. I know this is a case where equipment was installed, it was a trial, and now it's coming, so I know it's unique, but, tonight I'm gonna support it, but, I'm gonna be cautious to support, monies that are spent before resolutions come to us, in the future. So I just want to say that, but certainly kudos to the Sheriff's Department and the sheriff for providing this opportunity by way of this truck driving simulator to those in the Ignite program so that they have additional course offerings that they're able to partake in. Thanks.
You're welcome. Do we have additional discussion? Commissioner Flewelling.
Thank you, Mr. Chair. So, I don't like the process either. I don't like that it was there and then we want to buy it. But that's, for me, not so much a problem. My issue is more on the bigger picture of, understand we have custodial responsibility and they should leave our jail better than they come in. Why we have the longest jail stays in the state of Michigan, we've talked about it before. Why are people in our jail long enough to learn how to drive a truck and get a CDL and get a high school diploma and everything else? This is a larger problem that I think, I don't know if it's a board solution, a prosecutor, a courts. The system in this county is broken. We got numbers not too long ago about 190-day average stay. There's people that have been in our jail for years waiting trial. So they're getting CDLs and high school diplomas and all this. It's a grant. It's a $150,000 grant. I get it. We're up against the wall. We can't spend anything else, but we're going to keep doing this forever. Our jail's been at maximum occupancy since 1984 when it opened, and nobody does anything. We've got a situation in Davidson right now. A guy with multiple drunk drivings wipes out a wife or a mother and daughter, and well, he's still on the street. Done it in other counties too. So this is ridiculous that we've got people in jail for years. I don't disagree. If they're going to be in there for 5 years, let's let them get a skill. So when they get out, they have less chance of going right back in. Lower the recidivism rate. But Jesus, at some point, as a county, we got to look at what we're doing, because this is ridiculous. 191 days, I think it was. Other counties are averaging 22 days. What are we doing in this county? Maybe some of them want to be in there, but I doubt all of them. So I'll support it tonight, but again, it doesn't have so much to do with this, but we've got to fix the system in this county at some point in time.
Thank you, Commissioner. Do we have additional discussion? Commissioner Shoemaker.
Thank you, Mr. Chair. If the board is determined to move this forward, one, precedent is set, and then precedent gets set again, because since I've been here in my stay, we don't set precedent. We talk about it, we say we don't like it, but we move forward and continue to allow things to happen. Additionally, there are additional costs I'm sure that are going to have to be answered for this, so I hope you guys would have researched the fact is, are there software updates we're going to have to pay for annually that will not be covered by the grant? Is there an additional power that's going to be needed? Because these simulators, no matter what size simulator it is, are expensive. They do draw additional power. These are things that when we say, oh, we're just going to pass it, I don't think you've vetted this. So I would hope if you vote for it, you have. But like I said, none of this has been done. You have additional costs. Guess what? It takes effort to get someone out of their cell and bring them down here instead of keeping them with a group of people and watching over a group. There are dollars associated with this outside of what you're seeing on this paper. We just got a report from our CFO. We're not in as good a standing as you think we are financially. And those dollars are going to come from the general fund to take care of those inmates and bring them down to this simulator. And there are some grants associated with it, because we've learned that you can't guarantee on any grant or rely on any grant. But before you get done, if we could have the captain come up and answer some questions then, so you guys could at least understand it, I'd appreciate it if you would. If Captain Kennemer would come up and just just answer a few questions for me if I could, through the chair.
Of course. And then I've got Commissioner Flewelling. If you'd identify yourself for us.
Captain David Kettenberg, Genesee County Sheriff's Office.
Thank you,
Commissioner
Mr. Chair.
Shoemaker.
Thank you for calling me this week again. I appreciate it. Thank you for the conversation. We would have had it last week, but he had some personal matters to take care of, so he is here this week, so you guys can ask the question. But what is the software cost for this? Because obviously, as somebody who sells software, there's a cost to using that software at most
There's no
places.
cost in updating that software. It's installed on the computer that's on site. The only issue that we'd have is they'd have to remote in to fix it if there's a problem, but that's covered in the warranty of the program.
Okay, so I understand this fully. You're telling me that as Windows updates or anything else like that updates, is it a Windows-based platform software or what software it is?
It's a Windows-based program.
Okay. As Windows updates, you have to update your software. Software has to change. So they're going to come in for free just because you bought it for the perpetuity of the unit. If it's 10 years, 15 years, or whatever, and they're just going to keep fixing it or patching it or doing whatever.
For the initial 5 years or the warranty of the product,
What is,
they remote in and have remote access to update the firmware of the program.
Mr. Chair, if I may
You may.
continue. Thank you. So, do we know what the agreement is? Is it 5 years, is it 3 years, or do we know how long the
Off
agreement
the
is?
top of my head, I believe it was a 5-year. I haven't read the fine agreement of the terms of the software length of it. So I believe it was a 5-year, but
Okay.
I didn't refresh that because I didn't expect that question.
Has Corporation Counsel looked over this contract and this agreement?
I'm looking at it right now. The contract says it's 4 years from the effective date, and it expires on February 13th, 2030, unless it is canceled or extended as defined in this agreement. So, looks like it's 4 years. I'm not sure why 2030 is listed unless that's, if this started back on February 13th, I guess 2030 would be 4 years from February 13th, but this contract wouldn't begin until it's signed, and it's not signed that I know of.
It's not signed.
So, the contract's from February?
No, it doesn't become effective until it's
February of
signed.
next year.
No, until it's signed. I think that February 13th date is in here just from a placeholder, if you will.
Thank you.
Commissioner, yes.
Mr. Chair, thank you, if I may. Do we know what the cost of maintaining and keeping the unit up after the 4 years is done?
I have not looked into that, no, sir.
So these are just things, you know, would it stay status quo? Are they gonna charge you $150 grand again just to update and keep it going? Those are the things from there. Obviously, it's in a room right now, and you were nice enough to explain where that is. Like I said, I understand what we're trying to do here. But I also had residents reach out to me, and which I explained to the captain. My son, the exact words, more or less are, my son didn't do anything wrong, but they're not getting a free education. They have to pay if they want to go to a school, to a truck driving school. So once again, doing it right is a disadvantage. Like I said, there's so many reasons for this. Mostly processes just gets under my skin, and I thank you for tolerating my conversation with you the other day, because that's really the main portion. But on top of it, we have a lot of expenses this could go out as. This money can be used for other things. Now, I know it's a grant, so thank you for that. But Commissioner Flewelling last week asked for the other things that grant could be used for, and we'd mentioned, but I'd like to know what else we could have used it for also. Through the chair, please.
So when we first got the grant, we came to the board, got the approval for the grant. It was for positions at that time. Now, we didn't start using money from the grant because we had another grant we were finishing for those positions. Once that grant became exhausted, we began drawing funds from this grant. Now, this grant was designed to help prevent gun violence in our communities. applied for the grant. It was presented as Ignite, and the benefit of education, reducing crime through when they're incarcerated, giving them other means to prevent going back into what got them in that case. As that grant is getting ready to end, excuse me, about 10 months to a year ago, we approached the grant and said, we have a lot of money left in this grant because we didn't start it, we anticipated it, and we tried to extend that grant so we can continue to pay for the positions, and I believe those positions are going to be coming before you here shortly. And we had to wait for the grant administrator to talk to his people and get his approval for yay or nay. At that point, they said they're not going to extend it for positions, but they encouraged us to come up with a list of equipment that we could use in the Ignite program. This is one of the items that we were looking at starting or wanting to start for quite some time. We had a CDL course initially in Ignite many years ago, but it didn't have that virtual component in it, and it was just book work. We wanted to take that training into the next level. Now, we're not certifying them in the CDL. They will still have to get out and do the road work, but it is the best training that we could provide them while they're incarcerated to help facilitate them into gaining a productive career when they get out. So once we got approval for that, we then researched what simulators were out there. And we met with and talked with other counties that have some similar products. We decided with this one because it has the option of training in both like 18-wheeler, for lack of a better term, but also the garbage truck and snow plow. So that's why we chose this one. The other ones didn't have that option. So that's kind of like the backstory of how we got here and why it is coming now to the table.
You have the floor, Commissioner.
Mr. Chair. So this grant is to prevent gun violence?
Yes, sir.
This grant was for?
Yes, sir.
So there's a lot of things that, thinking of preventing gun violence, we could spend this money on. Just trying to understand. And if you could, my last thing, I believe it is, so thank you through the chair, is explain to me the process of a day when you're going to bring an inmate into the facility to use the facility. Are we going to their cell to pull them out, or is it their, just explain to me how the actual process works, how we decide which individual actually gets chosen to use the facility, because obviously it should be obviously, I don't want to say a treat, but it should actually be, something that good behavior should be probably rewarded to be allowed to use this facility. So.
Sure. It's definitely behavior-based. Those that have the ability to sign up, and it's a voluntarily sign up, are vetted through our team that makes sure that there's no separations, there's no security risks, there's no enemies trying to sign up for the same classes. Typically, this is offered to our Ignite University, and those are the inmates that are inside our jail that are taking education seriously. They have to be attending classes. They have to be doing their own work, whether it is on the computer or attending like community-related classes, like Elga puts on a financial literacy class on how to manage a checkbook in your account. And those are the inmates that we don't have any behavioral issues with at all. So we arise to the Ignite University, and with that comes some meritocracy. They get better uniforms and those kind of things. They get to spend time on a tablet where they can rent movies or listen to music. Those individuals are allowed to sign up, and if they vet through the security, if they don't have behavioral issues, then our staff will bring them to the classroom, just like they do in every community class that we have in the sheriff's office. They're not held in their cells. They're not held in the middle of the day room pod, because you can imagine the class size is limited, right? I can't have 118 inmates locked down and only give a class to 10 people. So we have spaces inside the sheriff's office that we've designated for educational, behavioral health classes, AA, NA, church, in the area. And the simulator is in a room that when we went to the new commissary provider, we don't use anymore. Because where commissary is being filled outside, so there's not a giant storage room of Snickers, honey buns, and whatnot on our site. So it's a secured room in an area that we're able to bring our inmates to so they can participate in both the class side of it and then the simulator practical, for lack of better words, driving side.
Thank you, I appreciate it. It's almost good enough to make me want to vote for it, but I'm still, because of the process, I'm just not going to, but thank you. Thank you, Mr. Chair.
You're welcome. Commissioner Fleury.
Thank you, Mr. Chair. Through you to the Corporation Council, does the contract that you're reading have any language about the renewal or cost?
I was just gonna ask the chair if I could speak up when you were done speaking to clarify what I was saying earlier. So I'm looking at this, the master agreement that was 4 years. And I might be using the wrong terminology because this is probably for purchasing, but it's a cooperative agreement between a company in Minnesota. It's called Sourcewell, and the company is out of Canada called Virage that makes this trucking simulator. I am assuming we are purchasing this through this cooperative agreement, and we're purchasing the simulator. So there's no contract. It's just we're purchasing this piece of equipment and the software and hardware that's included with that equipment. There's a 2 years warranty. There's options A, B, and C that it looks like we haven't purchased. That's to extend the warranty for 1 year, software upgrades for 1 year, and then extended warranty software upgrades and on-site maintenance for a year. So there's really no contract. We're just purchasing a piece of machinery with the software and hardware that allows it. We have a license to use the software that's in this product. So it's a one-time purchase of this simulator.
Okay.
Commissioner Flewelling, you have the floor.
Did you have something to add to that?
No, sir.
Oh, okay. So, well, well, I said I was gonna support it. Commissioner Shoemaker continuing to say the word process reminded me that over the last year and a half here, we've seen this a lot of times, right? We buy things on grants, we hire people on grants. Grant runs out, what do? We just continue to fund it somehow. So the concern that I have with this is if it's only 2 years, it's $150,000, and you said a 2-year warranty?
It's a 2-year warranty. It's just, it's like buying any machine.
Oh, 100%.
Once we buy it, we'll have it forever.
Right.
But there's only 2 years of support and warranty.
And so after 2 years of support and warranty, we don't know what the cost is gonna be, right?
Yes, the software, we would have to look at renewing some software
Yeah.
licenses at that point.
And that's what I'm afraid of, is that cost. I mean, the bulk of the cost is probably in the software, I would imagine. I mean, I know it's a simulator, but, so if there's some of my colleagues that are gonna continue, that wanna support this, that's fine, but I can't support this tonight without knowing what that legacy cost is gonna be, what the cost of continuing after 2 years to pay for software upgrades, maintenance to the hardware, even, if somebody gets too hard on it.
I was just, as you saw me kind of leaning forward, I just started thinking about because we need to make sure that we have all of the information. But the other thing is, one of the things that we didn't ask about is how many are going to be trained? How often? What's the usage of it? What does that cadence look like
So
as well? And, and so, I think, the other thing is, it'd be good to see some pictures of it too, or actually go down and see what it looks like. I mean, the good thing about this is it's already in. So it's already in as a trial. I'd like to see it as well. Is this one of those big simulators like they have for airplanes where you're walking right in it and it's something major, or is it, on the laptop computer or something? I mean, I'd like to see what it looks like. So I want to make a substitute motion to postpone it back to my committee.
Is there support?
For a later time.
Moved and supported to postpone back to governmental subcommittee meeting in August. Is that right, Mr. Chair?
Yes. Who's the lead on this project?
Myself and our Ignite team would.
And
be
your
the
who
leader.
team?
My Ignite team.
Ignite team. Okay, all right.
Is there discussion on the motion to postpone? Mr. Flewelling?
I certainly would like to see those long-term costs when it comes back of software upgrades, hardware maintenance, everything else, if we can see those.
And Mr. Chair, and I'd ask that, the team, and you guys do a good job, but, make sure that he receives the information and make sure we get that information as well.
Yes, sir. I can't address one of your concerns that you brought up now, if
Captain,
I may.
please.
As far as the class goes and how often it would be, we're working with a company that is willing to volunteer their time to us to come in 3 days a week to teach the class. Now, they have some funding through Michigan Works that they're getting recouped from, but they're coming in 3 days a week, a Monday, Wednesday, and Friday, to do these classes. Will be used regularly. It's probably one of the most popular classes because people see the tangible benefit of coming away with a skill on it, and it is a legit simulator. As far as you sit in it, you're in a semi-truck cab looking like seat where you have screens around you, a truck driver, steering wheel. There's a control computer where we're allowed to change weather conditions. We're even, for fun, allowed to have the police pull the truck over, which I tried to do when the sheriff sat in it.
Now, why would you do that to guys who are already incarcerated? But go ahead. If I may.
Yes, sir.
I'd like to have data about how many have already been through it during all of the data as it relates to the trial period as well. How many? You can't answer them all now.
No one's been through it
Oh, okay.
yet, other than our staff looking at it, putting it through its paces, seeing if it is what they said it was going to be, making sure that we understood the program itself. But we haven't put any inmates, have not set a seat in that yet.
Okay, thank you.
Commissioner Flewelling?
Here, thank you. One more question for you, Captain. I didn't think about that piece. So you've got volunteer instructors that are getting reimbursed through Michigan Works. Is that something that you guys can set up a contract with them for a term so that you know that it's going to last 3 years, 5 years, whatever it may be, so that cost is taken care of? I would just hate to see a year from now Michigan Works say, hey, we don't have any money left, and now Sheriff's Department has to come up with money to pay for instructors.
So, yeah, Michigan Works money is always ebb and flowing. So it's hard to nail that down in a long time. I will tell you, this instructor in this group is very, very committed. The last time they did the class, they didn't have any funding. They volunteered their time, and since the word of this has kind of gotten out, we've had other companies want to come in and participate and kind of donate into this program.
Do we have additional discussion on the motion? Commissioner Flewelling, you still have the floor if you want it.
No, I'm done. sir.
Okay, additional discussion? I'll just mention, Commissioner Avery.
I appreciate the expansion. I'm
Yes, sir.
a very big fan of the Ignite program. Supported it, all the years here and beforehand. That CDL piece is huge, not just because of just a truck driving. I'm actually a CDL holder of 30 years, and I went the old school way. I wish I had this way. But I think just complimentary is just the fact that there's such a wide range of the usage of that skill, from a church van to a local, the delivery to over the road. So I think it's more than just driving a truck, and it also brings some value to them when they're on the street. Police officers respect that because they know you went through a rigorous, training piece to get that. So I hope that hopefully we'll find the findings being worth the ROI as far as what we're doing. I'd like to see others who have used it, what's the lifespan they've had it, was it longevity, or was it just like Mr. Flynn was saying, was it just going to last for a year or so? It'd be nice to have some kind of comparison of someone who else has used it and have some years of comparison. So, but I thank you, though, for your work.
So just a couple quick things. Corporation Counsel pointed out to me that within our packet, there is a photo or a diagram of what it looks like, the unit. Related to that, and to Commissioner Lloyd's point, I assume you would welcome any commissioner at any time, well, not any time, we'd have to schedule it, but
We're
Through-
open every day, sir.
through 24, you ever run a 24/7 operation, right?
Yes.
So you're the point of contact, obviously, so if anyone here wanted to experience it, they just get a hold of you and make a plan.
Yes, other than Mr. Avery, because he already has his license.
Yeah, he could probably put us through our paces on that.
I just renew my license every 4 years. I don't
Okay.
utilize them.
All right, motion to postpone to the August 12th Governmental Operations Committee meeting. All those in favor say aye.
Aye.
Any opposed?
Aye.
The motion is carried. Commissioner Lloyd, we have number 11 that was also separated.
Yes, move number 11, resolution 2026-0806, approval of resolution recognizing July 2026 as Disability Pride Month in Genesee County, and then clarification around, no. Okay.
Support.
I'll move.
Yep, moved and supported. Is there discussion? Seeing no discussion,
Yeah,
Commissioner
just-
Lloyd.
Just one piece as it relates to pride in the name of this. This isn't related to, LGBTQ plus, but this is, pride is related to like a sense of, a sense of self-worth, if you will, for those that have disability, a sense of pride as it relates to them not being ashamed of having, disabilities and, being different than everybody else. So I just wanted to clarify in terms of the title there.
Do we have additional discussion? All those in favor, please say aye.
Aye.
Any opposed?
No.
Motion fails 4-2. Do you have a report, Mr. Lloyd?
No report. Thank you, Mr. Chair.
Thank you. Human Services Committee, chaired by Commissioner Winfrey, vice chaired by Commissioner Avery. Commissioner Winfrey.
Mr. Chair, the animal control. So it's already in here, we already just passed it?
Yeah, that's just an administrative that was based on the number. We don't need that.
Oh, okay, thank you.
Okay, thank you, Mr. Chair. This time I'll move items 1 through 12.
Support.
Items 1-12 have been moved as a consent agenda under the Human Services Committee. Do we have separations? Mr. Shoemaker.
If we could remove items 6, 7, 8, 9, and 10. We had a lot of discussion last meeting on those.
All right, I want to make sure I heard you. 6, 7, 8, 9, and 10?
Please.
Okay. So those are separated. Do we have additional separations? Any additional separations? I'm letting people look. All right, so the consent motion is items 1 through 5, and then items 11 and 12. Is there discussion? All those in favor, please say aye.
Aye.
Any opposed? The motion is carried. Commissioner Winfrey, the floor is yours.
I move resolution 2026-0848, approval of a resolution directing the Department of Senior Services to update their mission statement to align with the Genesee County Senior Services Task Force recommendations.
Is there support? I have a motion. Is there support?
Support.
All right. Thank you, Mr. Lloyd. Item 6 has been moved and supported. Is there discussion on the motion?
It would make a difference.
All those in favor, please signify by saying aye.
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 Any opposed?
Nay.
Nay.
Motion fails 3-2. Mr. Winfrey.
I move resolution 2026-0851, approval of a proposed 5% increase to the 17 senior millage funded senior centers for FY 2027.
Is there support?
Support.
Thank you, Mr. Lloyd. You always come through in a pinch. Is there discussion on the motion? Mr. Shoemaker.
Thank you, Mr. Chair. As I stated before, I don't agree with how these funds have been allocated equally. I am sorry, I believe, I'm not gonna tell somebody who can't get to their doctor's appointment or can't get to food or can't have food delivered to them, and that is a fixed amount, no, when we've increased at a higher amount what we're giving our senior centers with people who are generally driving there and arriving there by some means of transportation. So on this, I just want to let everybody know that's where I am. I don't think this was distributed correctly. So thank you, Mr. Chair.
You're welcome. Additional
I
discussion?
have discussion. I don't think we have to do and or. I think we can do both and. And so I support the both and approach. I think that when we entered into the discussions even about the senior task force, there wasn't a sentiment on this board that we, prioritize one group or another. I believe that in a sense, we're looking for a way to make sure we address the seniors as a whole across the county. I mean, there are seniors in all of our districts that may attend the senior centers, but yet don't utilize the services that maybe those who are homebound may use. And so what I am concerned about is I don't want to send a signal, talking about me, I'm not laying this at anybody's feet, but I don't want to send a signal, because it will send a signal. If these resolutions go down, it'll be in the paper and that kind of thing. I don't want to send a signal that we're picking and choosing the concerns of seniors or who's more important than another group. Let's postpone them all. Let's come up with a solution that addresses them all in a short order, and let's move the resolutions forward. And that's a suggestion in the vein of being constructive. It's easy to just vote and let them fail, but we started on this path to try to find solution that we think will address, the breadth of concerns and the sensitivities and such. So I guess my discussion is, what is the solution so that we're able to address your concerns, my concerns? We share the same concerns, but the task force aside, we're the commission, we make the decision. How do we move forward?
Commissioner Shoemaker.
Thank you, Mr. Chair. As I stated last time, my problem is I don't mind doing it across the board, but this recommendation is giving the senior centers a larger percentage than you're giving to other groups. And some other groups are not even getting funds. We have waited on this. We waited for the task force to bring us back recommendations for the last year, and they brought their recommendations. I've said it from day one when the task force was formed. When you go out there and you see the need, there's always going to be the need. We're never going to overcome the need right now until, one, we have some different health outcomes in our county. But I don't think if these go down or one goes down and one passes, that we're going to stop trying to do this. I am in belief that our senior services director and her staff have done a wonderful job. I think a lot of pressure has been put on them from outside forces. And I believe the senior centers are part of that. I don't think the board was unbiased the way we'd wanted to set it up. So, like I said, I just don't think the percentage is equal, and I think just giving 5% across the board while you tell people in home delivery system, guess what, this is a lower percentage, and then some groups that we do provide services with, that they're gonna get none, is the way I wanna do it. Do I agree? We definitely, this next resolution, need to move forward with increasing the lawn care service and all those other needs, and we're still not answering the whole amount as the director, when she came up last week, explained to us. So I thank you, Mr. Chair. I appreciate your comment. I don't think if this gets voted down or one or the other doesn't, I don't think that the senior millage team is gonna stop working on making this process better. I believe we're looking for that. So either way, like I said, I think our staff's gonna keep moving forward with it. So thank you, Mr. Chair.
You're welcome. Commissioner Lloyd.
Just some healthy debate, and I appreciate that and respect that. But yet, that's exactly, I think, the signal that it's going to send, because you'll have, and we know, because we put the task force together, and this, again, I'm not laying this at anybody's feet. I'm saying we know what the debate was, and we know the sensitivities around it and the emotions connected to it. What we all know, and I'm sure, well, I can't speak for everybody, but I believe I can, we all care about the seniors in this county. We all want to well serve the seniors of this county. If somebody disagreed, you can speak now, forever hold your peace. No, I'm joking. But what I've gathered from, this board is that we all care about the seniors. Now, how the finances are done, and how that is taken care of, hey, we all have different approaches of how we would do that. So, but what I'm saying is, I would rather have a solution that just addresses it. I mean, even when you talk about the different vendor providers, even if you said 5%, I don't know the funding we have there. I don't even know if somebody's suggesting that every provider gets a 5% increase. I don't know. I don't know who's providing what. I'm saying I'm not comfortable, providing money to, the providers and then not doing some for the senior centers, because now we're kind of picking. I think we're kind of then doing what we were trying not to do, at least what I was trying not to do, which was to be able to, address it all. So I'll just stop because I'm being a little redundant, but, I do have sensitivities around some resolutions passing, some not. I'm not saying we got to take all of their recommendations. I'm not saying I necessarily, agree with all of the recommendations. I'm talking specific about how we fund whatever increases we're able to do. Is it a funding issue whereby we're not able to do something for both areas here? And that's a question of ignorance, because I don't know. I mean, is it monies available for us to address both? Is it either or? I know I'm not asking the question clearly, but maybe somebody can help me out fill in the blanks. What's the issue?
Mr. Lloyd, we have both the Director of Senior Services and also our CFO here. If both of you would approach and allow Mr. Lloyd to ask a couple finance questions.
Yeah, yes.
They said some of this last week, I think, where they worked through the fund balance and tried to, allow for different groups of seniors to benefit from that large, what I think is a large fund balance. So I'll throw it to you too. Would you identify yourselves for us?
Lynn Radzalowski, Senior Services Director.
Crystal Simpson, CFO.
So if you can, just talk to me like, I'm not going to say that because we're on TV and stuff like that. I'm not totally empty of any knowledge, but if you can just fill in all the blanks. What's the issue? What can't we do? Just talk to me.
Do you want to talk about how these amounts were developed, maybe?
Sure.
Would be helpful?
So through the chair to you and to all the commissioners, this came again from the task force recommendation to give an increase to all of the senior centers. It came across as 5% as being a solid amount. It's more than inflation, but it's not going to, spend down all of the fund balance. It was then looked at the service providers to get a certain dollar amount to get to work down the waiting lists. We found a good number that was solid. It spent down the fund balance but didn't deplete it. With that being said, with last week's innovation fund not being voted to move forward, that pot of money is still in the fund balance that could be reallocated at this board's approval to maybe more of the service providers to even up from the 5% to the senior centers to the 2% that's currently being recommended for the service providers with wait lists.
Okay, can I jump in? Just a couple questions. I just want to stay with you, if I may.
You may.
Mr. Chair. So the recommendation is, as it sits now, 2% for the fund for the providers. Is that what you're saying?
That's what it came out to be. We
Okay.
did the numbers after the meeting. Yep.
Okay. And was that 2% for each provider, or is it just, it's a 2% in terms of total dollar amount, and then it's going to be divided up amongst whatever we want to get down in terms of waiting list?
2% for each of the service providers that has a waiting list for
That
our
has a-
in-home services.
Okay. So if we give the providers 5% and we give the senior centers 5%, this is a yes or no question. I'm looking for a yes or no, and you can give me whatever you want to give with it. Did I hear you correct that the resources are there in fund balance to be able to do that?
I can't do that at the podium. I could do the analysis for you and get back to you, but I don't know off the top of my head.
So what were you referring to?
So in last week's committee meetings, there was one agenda item that did not pass, and it was the Innovation Fund for the senior centers, and that was approximately $496,000. That was put in the budget with using the fund balance. So with that not being passed, that's actually, I guess you could say, earmarked as a possibility to use that $496,000 towards something else.
Okay, if I may.
You may.
So the resources for the 5%, that's not a part of this 400,000 you're talking about, right? For the senior centers.
Correct.
Okay.
Totally different.
Right.
So the 400,000, because we already had the 200,000, the 2% for the vendors, the service providers, that's also not a part of the 400,000.
Correct.
Okay. So if we add the 400,000 to the vendors, will that get us to the 5%? Does that make sense?
I don't have the numbers right in front of me, but I could do that analysis if you wanted to wait until the next committee meeting and then the board meeting to approve it.
Yeah, I think it's
That's what
important to
you
know what that dollar amount, because if we didn't pass it last week, we have a lot of resolutions, a lot of business. I don't remember everything, all right? And this is one I just don't remember, okay? If we didn't pass what were we passing the 400,000 for? This sounds terrible, but I don't care.
Innovation Fund?
I'm being
Yes.
honest.
Yes.
Okay.
There was a recommendation to come forward that there be a 5% of the overall revenue for an innovation fund for the senior centers that they could apply for different things in their centers. That motion failed, but we still had the 496
clear.
allocated for that. So it's just in the fund balance now, but that money could, at the board's approval, be used towards maybe evening up the service.
I'm clear.
Mr. Lloyd, may I insert something?
I'm clear and
Go.
I've been refreshed. Okay.
So I was just going to say, my understanding, and Mr. Chair, if I might, the 5% is really about trying to help senior centers catch up on general operations that inflation has eaten at over the years. We gave them 5% last year, but before that, there wasn't a lot of helping them catch up, as I understand it. So that 5% is about not new programming, but helping them shore up existing operations to make sure they can operate. The Innovation Fund, the second part of that was about unmet needs at the senior centers or new programming at the senior centers that initial 5% isn't about at all. Am I right? So,
Correct.
for example, if my senior center in Flushing has a really popular Zumba class and they've got an instructor that they have to pay and it's full, and they don't have enough money to expand that, if there's a waiting list for another Zumba class, the Innovation and New Program Fund could have covered some of that, I think.
Correct.
So that's what that second fund was for, but it was not supported last week, so that's where we have the almost $500,000 that can go for anything that the millage says it can go for, which is services for seniors 60 and up in this county. Does that help?
Yeah, it's very, very helpful. Very helpful. So just as one follow-up. So I'd love for you to run those numbers, see what it takes to get us to, I'm talking just for me. I'm only one commissioner, one vote. I'd love to see you do the numbers, see what it takes to get to 5%, and tell us what that, and if it's a shortfall, I'd like to know that as well. When you figure it out, if you can call me directly, let me know. Obviously, let the full board know, but I'd like to know as soon as you had the numbers directly from you, and then we can go from there. You know, love the seniors, care about the seniors, been raised by seniors, supported seniors from the beginning of my time in politics. At 22 years old, one of the first projects that I took on was upgrades at the senior center in my district, new pool tables, new couches, and new sporting equipment, et cetera, et cetera, et cetera. Why? Because I believe that after all that the seniors have done for this community at large and their families, that when they get into their fourth quarter of their year, that they are not forgotten about, but they're provided for, and that they are prioritized. And I think by taking this approach where we're providing increased resources for the senior centers, as well as providing additional resources to the vendors and the providers to get those waiting lists down, we're not only taking care of those able-bodied seniors that are moving around and frequenting centers, but we're also looking out for those who may not be able to make it to centers, who have great need but dwindling resources as well. Again, I would prefer not to see a situation where we prioritize one group over the other, or we have resolutions that end up voted down, but to be able to say to the community at large that we prioritize our seniors as a whole and we address the issue. One last comment, and I'll digress. I have no more questions after this. This is a great example as it relates to every commission we have in this county that represent the Board of Commissioners, every commission we have, all of the boards that we appoint and so on and so forth, particularly those that make recommendations to us. We appoint them, and that's our opportunity to have feedback from the community. But at the end of the day, it's our responsibility and it's our decision. And it's not a slight against the senior task force. They did a great job. We all appointed folks and they approached it with their perspective, and I'm sure doing their best for the residents. But this is just one of those situations where it's our job to make sure it's right. So thank you for the recommendations and the time, but now we get a chance to do our job. So with that said, I'm going to make a substitute motion to postpone each of these resolutions that have to do with senior recommendations. I know we already had one that failed, but one is resolution, if I may, 2026-0851, that's the 5% for the senior centers. Also, resolution 2026-0853, and that's dealing with the lawn care, snow maintenance, transportation, home delivery meals. And I think somebody else can help me with the rest of them. Is it 0854?
It goes through number 10.
I make a substitute motion that we postpone item number 7 through item number 10 to the next Human Services Committee, and look forward to getting more information back from you.
Is there support?
Support.
One we're on right now.
Moved and supported. So the motion on the floor, postpone item 7 through 10 to the next Human Services Committee meeting. Let me just, before I call on you, Commissioner Shoemaker, can the staff sit, or do we have more questions for them?
No.
Mr. Flewelling, if while they're here.
Oh, yes, thank you. Just a couple of quick questions. What is the increase in the millage revenue from last year to this year projected? Like, I don't know if you know that.
I don't know off the top of my
Okay,
head, but I
so
can get that as part of
when
this.
we postpone this, if
Yeah,
you would, if
sure.
it's 5%, 10%, whatever, that would help.
Sure.
Question for me, for going to the next meeting, clarity. With this millage, was this millage passed for senior centers or passed for seniors? To assist seniors, because it seems, again, we go back to the conversation last fall, and I'm not gonna be on this long, but we established this commission to determine the best use of this money. And if 80% of the people on the committee are senior center regulars, I see where these where these recommendations come from, right? So, my question to you is, 2%, Commissioner Lloyd said 5%, 2% shortens the waiting list. That's great if you take 20 people off, but you're number 21 on that list, right? Doesn't do much for you. So that would be my interest in seeing what this looks like, right? I'm not saying senior centers don't need another 5%, but they got 5% last year. That was the whole point to the task force, tell us where to spend the money, right? We've heard a lot from senior centers and particular directors that want this large chunk and percentage of that money. Well, guess what? My dad didn't go to a senior center. My dad needed in-home care. We had to pay for that. So another 5% to the senior center wouldn't have helped him at all, right? And there's a lot of other people out there like that. So I would just like to see what that increase was. And for myself, I'm going to keep in mind that this is not a senior center millage. It's a senior services millage. And there's plenty of people that are in differing states of health that can't take part in congregate meals at senior centers. They gotta be spoon-fed at home. Thank you.
You're welcome, Commissioner. Are the ladies allowed to sit? Anything else for them? Thank you both.
Only one point of clarification, if that's okay.
Yes.
The resolution here for you is only for service providers with waiting lists. Is that what you want us to do as part of the analysis, or do you want the increase across all service providers?
I mean this respectfully. I defer to my colleague, Commissioner Shoemaker, and I'll tell you why I'm deferring. Because when you spoke to, hey, listen, I'm paraphrasing, hey, we didn't do anything with those groups. I'm just curious, what is it that you were expecting or desire for those groups? Because we didn't get a chance to flush that out.
If I may.
Commissioner Shoemaker, you may, of
Thank you,
course.
Mr. Chair. Well, I think I'd written something down, and I think Commissioner Flewelling hit it best. It's not just 2%. We're only giving 2% to the ones that have a waiting list. So they're just trying to get caught on wait list. They're not getting any cost of living increase. They're not getting any of the above. So you're basically telling them, because they had cost increases, trust me, to put fuel in your car, do something like that, guess what? All these programs, the cost is increased. So when you're going to pick up a resident compared to even a year ago, it might be another 30% increase just for the cost to run your vehicle. Repairs on vehicles have gone through the roof. Door rate at your average dealership is actually $200 and some in a repair shop plus per hour. These costs have all gone up, and you've given 2% just to cover, their recommendation is 2% just to cover backlog. Not an increase so we can make sure they can do more, because what we've actually told them by capping them where they are right now, you're gonna do less because your expenses have increased. So they're actually gonna be able to serve less people if you keep the cost the same. So I would like to see it across the board at everyone. So all of our groups get that increase, so those programs that are falling through the cracks, or the programs that are falling behind because they have to drop off a vehicle and they have to load it up in a car, and the fuel costs have increased, the insurance costs have increased, or whatever have increased, they can recoup some of those. Because that's what we just said. We did this. This is what was said. We gave them the 5% to the senior centers so they could deal with the cost of inflation. But we didn't do that for the people actually taking care of our seniors. And I'm sorry, I can't get behind that. Because the senior centers have a voice. They can get out and kind of get a voice going. Where when you're in your home and you're in your bed and you can't be taken care of because you're waiting on somebody to come help you, or you can't get out to get a meal, or you can't get out to pick up your groceries, you don't have a voice. Because you can't afford the internet. It'd be like you can afford rabbit ears and some other, a TV maybe. When this millage was passed years ago, it was sold to help those who need help. And I'm not saying people at senior centers don't. And I agree with what you're saying is trying to be as fair as possible. But again, I can't go back and I can't knock doors and go to a house where people can't get out, where there's cobwebs all the doors because they haven't been out of the house, and say I'm doing what I believe is right by giving the senior centers far more as a percentage than we are our most vulnerable seniors. So I would like to see it all, and if the board agrees, I want to see it. If we're going to work up those numbers, I would like to see it across the entire spectrum of caregivers. Thank you, Mr. Chair.
You're welcome. So the motion is to postpone to the August 12th Human Services meeting. Is there additional discussion? So if I may just chime in real quick, consistent with what Commissioner Shoemaker said, so on this applies to item number 8, so 0853. Right now, the resolution as it's written and as it came out of committee and as we're postponing it is really the 2% for providers that provide these services. It doesn't include a number of other providers. That's yes, I think. So we can't, this resolution is going to come back in this form, to your question, Crystal. But I do think that it would be helpful to have the data that Commissioner Shoemaker has asked for, because we can amend it when it gets to the committee meeting, if the majority wishes to do so, to reflect a larger increase for across all providers that are that makes sense to everyone? mean, it's got to come back in this form. So we would want your assessment of, I think, what he's saying, so that we have the possibility of amending it when it's moved on to when it's moved again. Commissioner Shoemaker, it looks like you want to.
I just wanted to go through the chair to Corporation Council. Would we be better off not using these resolutions at all and putting a substitute resolution forward, asking Corporation Council to work with the CFO to produce what we just asked for instead of using these resolutions? Because they have to come back, basically, if we're going to if we postpone them as they are. And then we're going to have to go through the process of amending them on the floor and discussion of that. So I'm just trying to speed up the process. Please.
So what we can do is, I think we have a sense, I think staff has a sense of what you're asking for. And we can bring separate resolutions forward that we'll have here in case you want to move forward with this. And then what you would do at the next meeting is just drop these and then move these other resolutions.
Thank you, Mr. Freeman.
All right. Mr. Lloyd.
I appreciate that. It's going to be necessary to have discussion to work through it. I mean, and nobody's suggesting that it's not, but the task force has had meetings to work through it. It's not going to be as simple. It may not be as simple as, here's a resolution. We have to talk through it, because one of the pieces is, one of the things that I'm sure of, unless you all, well, without you coming back, I'm sure of it based on 400,000 being available, is that we're not going to be able to do, we're not going to be able to give, unless you say something different, 5% to get waiting lists down, 5% for cost of living, not cost of living, but for inflation, 5% for the senior centers. We're not going to be able to do that. We already, unless you say something different.
I don't know. I don't think so, but
So-
we'll crunch the numbers and see.
Yes. So we know that there are those that desire to support giving the senior centers increases. We know that those are recommendations that also came from the task force. I also don't agree that just those vendors, and maybe you're not suggesting this, but just the providers are the ones that's providing services to the seniors. I believe that the senior centers provide services, and there are services within the senior centers that are being provided, whether it's classes, whether it's, whatever other support, meals, whatever it is. So I think they're all being provided services. What's different is the state that the seniors may be in and what services they may, need, what have you. But that's off the wrench. So I think we got to figure out, is it 5% cost of living, inflation, 5% to the centers? Is it something different? Are we not focused on the inflation, but we're focused on the excuse me, my mind's going, or the wait list. I think we got to be realistic about it, because if we just say, hey, to hell with the centers, and let's just worry about the vendors, that's not going to work. You know what I mean? And I don't think it's the fair approach. So we have a couple weeks for you to work numbers, for us to talk, for there to be conversation and us. So maybe the suggestion is, maybe we need to have different proposals that come, that have different makeups of these things.
Yeah, I think that's what Mr. Freeman was saying. These will come back for sure.
Right.
Because that's what's been, the motion is to postpone these. And you're suggesting that based on what you're hearing, you'll have other resolutions as options. And then we as a group will have a robust discussion in the Human Services Committee. That sounds like what you're recommending?
Yeah. Okay, I'm good. I digress. Thanks.
It's okay. Mr. Kuzno.
My question is are we gonna go through this every year? Because the amount of money that comes in for the millage is usually increased, but it changes every year. So are we gonna have this discussion, how to spend that money every year? Or are we gonna try to come up with a solution to take care of this for multiple years? I think that's something we need to think about. Thank you.
You're welcome. Motion is to postpone. Is there additional discussion? Thank you both. We appreciate you. All those in favor, please signify by saying aye.
Aye.
Any opposed? Motion is carried. I believe that completes the agenda. Mr. Winfrey, do you have a report?
No report.
Thank you, sir. The Public Works Committee, last but not least, Chairman Brian Flewelling and Vice Chair James Avery. Commissioner Flewelling, the floor is yours.
Thank you, Mr. Chair. I would offer items 1 through 12.
A consent agenda has been moved in the form of items 1 through 12. Are there separations? Any separations? All right, moved and supported. Is there discussion on the motion? All those in favor, please signify by saying aye.
Aye.
Any opposed? The motion is carried. Commissioner Flewelling, do you have a report?
Oh, sir.
I had a question about 10, and I missed it, but we voted on it.
Is it just a question where you need information? Can you ask it in a different setting, or would you like to?
I can ask it in another setting. I can seek the information in another setting. I just was going to say that I wanted more information about the purpose of these cameras in that space. I don't know that we had a lot of discussion about this in the committee
They're
meeting.
just additional cameras. We're building out courtroom 2, so it needed cameras in there, which wasn't in the original bid, and then they needed another camera in the legal resource.
Got it. Thank you.
All right, thank you, Mr. Lloyd. Thank you, Mr. Freeman. Mr. Flewelling, do you have a report? You said no already?
No,
All right.
sir.
It appears we have no unfinished business. We also do not have any new and miscellaneous business. Therefore, the Board of Commissioners is adjourned at 7:48.
Hey, the up and coming.
I've never seen anybody do it better than you.
You know what? I appreciate that, Marty.
The emerging
I try to be
singers.
efficient.
Oh, God.